It is Tuesday, December 8th. Welcome to the Kahnawà COVID-19 Task Force update. It is our 158th update. It has been a busy time of late in Quebec over the weekend. In the last few days, over 2,000 new cases, which was a new Canadian record, not a good one. In Ontario, they've gotten very close to that, as well as out in Alberta. So things are difficult out there. We, of course, in Kahnawà are taking care of business at the task force, and joining us with her update today from the task force is the Executive Director of the Kahnawà Memorial Hospital Centre, Lisa Westaway.
Good afternoon. Thank you, Joe. So I'm going to speak more generally today and then go more specific. So we'll talk, as Joe is mentioning, how the situation is in the communities around us in Quebec. The situation is getting worse every day. We do see that there are increased hospitalizations, use of ICU beds, and the ministry is rolling out right now their project to decrease elective surgeries so that they can be sure to have resources in place to deal with COVID-related hospitalizations. So we know that the situation is getting worse, and with the upcoming holidays, we expect increased contacts and gatherings, and therefore a continued increase in number of cases and number of hospitalizations, as well as increased death rates. And we are seeing increased death rates all around, including outbreaks in various schools, long-term care facilities, private residences, family-type residents, as well as workplaces. So it's important that we take this seriously because these increased cases can translate to more contacts and increased transmission of the virus here in Kahnawà as well. And so it's always important that we're aware of what's happening around us. So again, as we had done earlier in the pandemic, we do recommend that you stay home as much as possible, that you stay local as much as possible, and that you limit your contacts with other people as much as possible as well. If you are going to be meeting with other people, as we know, for mental health reasons, you can have in other households within your home, that you're always thinking about distance, hygiene, and masks, meaning you're not sharing utensils, you're not within each other's 2-meter space, and you're washing your hands several times during the visit in order to limit the possible transmission of the virus if you happen to have COVID-19. Remember that many people walk around without symptoms or without symptoms 2 days prior to actually feeling sick, and therefore that is the window when transmission of the virus happens most often and where we can infect people that we love. So it's really important to maintain distance. So we'll talk a little bit about the testing site at KMHC. We continue to test regularly. We are now open 5 days a week because of the increased demand for testing. And we are testing 10 to 15 people per day. But we're also rolling out, because of increased contacts happening all around, including in Kahnawà, we are rolling out a screening process. So remember the difference between a screen and a test. A screen is when we do a COVID-19 screen. It's just like a test, but it's called a screen. I know it's confusing. It's on somebody who doesn't have symptoms, and it's preventative. It's a preventative measure in order to identify either asymptomatic carriers or people very quickly prior to symptoms showing. We know that when we don't have symptoms, it's very difficult to get a positive test, meaning that the more symptoms we have, the more likely we are to show a positive screen or test, but we still do this for preventative measures. So this is a preventative measure that will take place and is rolling out as of tomorrow for all staff and natural caregivers at KMHC inpatient, in home care, for employees at Elders Lodge and at ILC as well. So I'll speak a little bit later about ILC. I'll continue for now on this screening process. So screening is going to take place 3 times over the holidays. This is a measure that we're implementing within the community for our most vulnerable patients to ensure that our staff, despite the fact that there are increased contacts happening all over Quebec, including in Kahnawà over the holiday time, that should there be a risk, that we identify it quickly and we contain the virus so as not to transmit anything to our residents. So that is rolling out tomorrow. After, and will happen at 3 specific times during the holiday period. After the holidays, we will reassess what's happening within Quebec, within Kahnawà, to determine whether these screenings should continue on a regular basis, but for now we have the 3 planned. So we continue to test, and test is people who have symptoms, 10 to 15 people per day. That's great. We urge you, if you have symptoms, to not go into work. If you have symptoms, you stay home and you contact the testing site to schedule your test. So on the subject of testing, I want to talk a little bit about that. We talked about it yesterday morning on K103, but it's an important subject that we wanted to bring up here again today. So, and it's so important that we put out directive number 51 today about reporting requirements for business and community organizations. So, as we know, when someone is tested at the KMHC testing site, we have quick access to results. When someone is tested at another site, we don't receive the information as quickly as we would like to. So we happen to be very special in Kahnawà in the sense that we have a local public health team that takes pride in calling each and every positive case and in doing individualized, personalized contact tracing with each of their contacts. So this does not exist in any other city right now because of the overload. So it's been quite some time since regional public health teams have had the ability to contact trace in the way that we do in Kahnawà. And remember, I mentioned this before, but it's important to mention it again, the ability to contact trace within 48 hours of identifying a positive case makes a difference in containing the virus and in the ability to contain the virus. And part of our success here is that we're able to contact trace quickly. So if someone is tested at a site outside of Kahnawà, by the time we get the information from the regional public health team, it's already too late to contact trace within that short, important window. And therefore, we have risk of transmission within the community. Now, there are different reasons why people may go to another site. They may live outside of Kahnawà and therefore go to a site close to their home. They may not want to be known or be known that they're being tested, so they may go to an outside site. But I think it's important that we talk about this because it is important that we get tested at our own site so that we have quick access to information and we could react quickly. The information is confidential with our local public health team, who are the only people that get the results. And so the directive is with respect to a request to be tested in Kahnawà if you work or live in Kahnawà. That's the request that we're making of you. Of course, we can't force that on anybody, so we have a second part to the directive, and that is that if you are tested at another site, that you advise our public health team that you have been tested and that you provide us with results as quickly as you possibly can, or that your employer let us know that you have been tested. So our local public health team is at our regular KMHC phone number, 450-638-3930, and the extension is 2213, and you'll find that also on the directive on the communique that went out today and on all the Facebook pages. So again, we ask that you let us know so that we can contact trace, we can do our personalized, we can have personalized conversations with each and every individual, and we can also work with your workplace, which is really important. Work with your workplace so that all of your colleagues, if required, to contact trace and advise, so that everybody understands their role and responsibility within this particular case and what they need to do to ensure to mitigate risk. And that is really important so that we don't develop outbreaks within our work sites. For now, we have done really well. We have not had any outbreaks in our individual businesses or besides the one that we're going to talk about very shortly and that we identified last week. However, we see that there's potential. There's potential because we don't always have the information we need to act quickly, and so we're asking for the community to assist us with that so that we can do what we have to do and mitigate risk and transmission of the virus as much as possible. So thank you for your collaboration with respect to that. So presently we have 2 active cases in Kahnawà, and remember, the active cases are those we know of those who are positive who have been tested. We know that there's a potential that there are community members who have symptoms who have not been tested, but of those we know of, we have 2 active positive cases. I wanted to give a little bit of an update about ILC. Next, since we're talking about screening and testing. So as you know, we had an outbreak at ILC, the Independent Living Center, last week, which an outbreak consists of 2 individuals who are linked. So it's called an epidemiological link. So 2 people who one contracted the virus from the other, for example, so they're linked in a sense. And in a health and social service organization, when there are 2 people who have the virus who are linked, then that is considered an outbreak, and it's an indication for at times a SWAT team to be involved and or an emergency team, and important measures to be put in place to contain the virus as much as possible. And the communiqué that went out on Friday explains the measures that were taken very quickly, and so I just wanted to give you an update as to where we are at with that. So retraining has regarding infection prevention and control measures for all staff has taken place on 3 occasions. Residents are still isolated. Proper use of masking is part of the training, so PPE, ensuring that hygiene measures are consistently being followed. The staff check symptom log is being completed every day and being monitored. So there are many tightening, we'll call it tightening up of existing measures that have taken place, and everyone is working really hard, including the staff and the residents, in ensuring to mitigate safety for all, and it's going really, really well. So the other part that is included in mitigating the risk and in reducing, hopefully, the transmission of the virus is screening. So as you recall, last week we mentioned that all staff, all residents, and any individuals who had gone into ILC within a specific time frame would be screened, and that has taken place. So if first screening happens in an outbreak such as this, the recommendation is that screening happens every 5 days throughout the time of the outbreak. And the outbreak is 14 to 28 days from the last positive case. So we will do another screen of all employees, of all residents, and of any person who has entered into ILC. That will take place very shortly, 5 days after the first, so that will be Wednesday, tomorrow. So that screen will take place. We did receive results from the first screening and the tests were negative, but a reminder that it could take up to 14 days before somebody might develop symptoms and have a positive screen, and therefore that is the explanation as to why we continue to screen every 5 days, so that we catch whatever we need to really quickly and we contain. So for now, we're cautiously optimistic that everything is going smoothly, measures are strict, and everybody is doing what they have to do to ensure that we don't, that people are safe. So that's the update to provide for ILC. So just to talk a little bit about a few KMHC details that I wanted to advise you about. As you know, every 2 weeks we do have a Sunday drop-off for inpatient residents. Our last Sunday drop-off before the holidays is this Sunday, so the 13th of December from 10 o'clock till 1 o'clock. It's the last one before the holidays, and I think this is important because we cannot accept anything outside of those Sunday drop-offs, because we have important protocols in place to ensure that we sanitize and that whatever we deliver to residents is safe. So the 13th is the last drop-off. And please tell family and friends that if there is anything that they want to bring in, that would be the day to do it. The other element that I wanted to remind you about, there was a communique that went out about our Christmas tree gift giving. Every year we have a tree in our outpatient department with a number on it that represents one of our residents, and community has loved this event where they would pick a number and bring in a gift for the residents. Unfortunately, we can't organize the gift giving in that way this year because of COVID-19, so everything has to be adapted. So in order to try to find the simplest way possible, what we've done is we ask that if you're interested in participating in this year's gift giving event for our inpatient residents, that you call KMHC and you'll be transferred to our switchboard where you'll get all of the pertinent information to be able to choose a gift for a resident. And again, what we would ask is that those gifts be delivered on the 13th at the Sunday drop-off. They can be wrapped, but they must be identified with the number that you're going to be given by the switchboard. If we see that the 13th does not allow enough time for people to shop and bring in a gift, then we'll evaluate whether we should be organizing another drop-off specifically for the inpatient gifts. So thank you very much for participating in this event. It's a great event for our residents. So the last, two last points that I wanted to cover today. Number one is about visitation, so during the holidays. So as you know, we have put out our recommendations for how you may visit safely over the holiday time. But I think it's important to at least specify the fact that there are degrees of risk in the choices that we make. So we've spoken about this before, that each of us as individuals or our families have the responsibility to analyze the level of risk that we are comfortable with within our families. So it's the safest thing to do over the holidays is to spend the holidays with only our household. So our immediate family or the people that we live with, that is the safest thing to do. Of course, if you choose to have another household within your home, then the next safest thing to do would be to limit that to one other household in the way that we're doing now, once a week, and that would be it. So the more you limit your contacts, the safer you are. And that's kind of the gradation of measures that we're proposing that you look at when you're analyzing what's acceptable for yourselves and your families. So the safest is just your household. Secondly, if you want to move up from that just a little bit, it's having another household in your home. Again, following all safety measures of distance, hygiene, masks, not sharing utensils, having your own bathrooms, or sanitizing your bathroom after every use, all of the educational stuff that we've spoken about. The next level would be having another household in your home, maybe once per day or twice per day, but never more than 2 households in your home at a time. Why do we recommend this? Because we know that even having 2 households, it's very difficult for those 2 households to maintain appropriate distance to ensure not to transmit the virus. But once you add in a 3rd household, it's practically impossible. And if your house is that big, every household will be in a different room anyway, so you're not really gathering. So what we suggest is never more than 2 households at a time. So again, we ask you to really speak with your family, establish what's an acceptable level of risk for you, knowing what we've described today as the situation in Quebec, in Montérégie, in Montreal. The level of risk assessment is really important for you to do with your family, because it really, you are putting yourselves and family members at risk. If there is anyone who's vulnerable in your family or immunosuppressed, again, your level of risk increases increases drastically, and you should have to think really seriously about how you might want to spend the holidays. So I just wanted to give a bit of that information, and we'll continue to talk about it between now and Christmas time, because we'll keep you posted about what's happening all around us. Lastly, I wanted to talk very, very, very briefly about vaccinations, and we're getting a lot of questions at the task force about vaccines. So firstly, I would like to say that there are no vaccines that have FDA approval yet. So we see that in the UK there's a rollout of vaccines, but there is no FDA approval and there's no Health Canada approval here in Canada either. So both the US and Canada have not approved. But what we are hearing about is we're hearing about rollout strategies. So I spoke with Dr. Gauthier about this a little bit this morning, and so a lot of the information I'm presenting to you comes from her. So there are many unknowns about the vaccine. The first is that we don't know how long someone will be immune for. So when we did receive data about the efficacy rates of vaccines, so the Pfizer vaccine, for example, which is the one that they're talking about rolling out here in December, that had a 94% efficacy rate, and that was based on immunity 2 weeks after the second dose was provided. So we still do not have any documentation or data about anything past 2 months. Of course, it's been several months since that data was released, and so we should have data soon, and that's what Health Canada is waiting for before they approve the vaccine. So we're waiting for that efficacy data as well as other data to be able to determine whether the vaccine will be approved or not. These are some of the elements. Of course, I don't work at Health Canada and I don't have all the details about what they do, but that is one element that they're waiting for. They're also, they also are looking at the transportation. So what we know is that this vaccine needs to be kept at very, very cold temperatures, and so how they roll out the process of transporting the vaccine to various cities, communities, is something important, and the reason why they're focusing on it now is to save time. So as Dr. Gauthier pointed out to me this morning, what normally happens with vaccine approval are many elements are sequential in nature. So once Health Canada approves, then they may look at transportation or rollout, whereas now everything is happening in parallel at the same time so that things can go a little bit more quickly. So what you hear in the media is talking about prioritization, talking about how the vaccine will be rolled out in the different communities, where it will be done and how, but again, we still don't have approval from Health Canada, and so everything is kind of tentative until we have that approval. The information that we have up till now in Quebec is that there will be approximately 20 vaccination sites. What we hear very tentatively right now is that there will be only 1, maybe 2 sites in the Montérégie area. We do not yet have any more details, and we are pushing to be able to vaccinate within our own community. But as I was reminded, for measles vaccines several years ago in the 1980s, we were requested to go to outside of the community for vaccination. This is still all very up in the air, and we don't have a lot of information yet. We are involved in many discussions, but we don't have any details yet because this is still just being worked out. But remember, the fact that the vaccine needs to be kept at very cold temperatures means that there may be limited distribution ways. So we're waiting to find out a little bit more about that. Prioritization, we also don't have a lot of information about that. There are mixed messages in the media, some saying that Indigenous communities will be prioritized, others looking more at remote communities. That includes Indigenous communities in remote areas. However, we're we're in the city, so we may not fall into those categories. So all of this is still being worked out as we speak. What we do know is that long-term care facilities, no matter who you speak to, are always at the top of the list. Health and social services and people who are vulnerable and in remote communities are also at the top of the list. But again, we don't have any official information about that yet. So This is the information that I can provide to you today about vaccinations. We will continue to keep you posted. As you see, this is a subject that's moving quickly, and we are keeping up to date and informed, and so we'll do the same for you. So thank you.
All right, thank you very much, Lisa. Lots of information today. She mentioned about vaccinations, and you know what? There was something I had to say on the news this weekend, talking about the rates. The Kahnawà First Nation in Ontario has had an outbreak, and we always say how fortunate we are here in Kahnawake, the work that we're doing to keep everyone safe, and the work that the people are doing to keep ourselves safe. Kahnawà had an outbreak. It's a small community, and when they did tests, they were coming back at a 68% positive rate, which is incredible, because an outbreak, I think a 5% is where you're trying to keep it under 5%. They're at 68%. So some of our brothers and sisters out there are having a very difficult time. So you know, we got to keep up the good work, so to speak. Also, just to touch on what Lisa was saying about the gifts to the Kahnawà Memorial Hospital patients, please do so. I think they are at about half. They have enough for half the patients right now. So just participate. Call reception there, and they'll give you a name, and they'll give you suggestions for some gifts for the patients. They really do appreciate that. And just a couple of last notes. Don't forget that the holiday train, the big concert is coming up. The virtual concert is coming up on Saturday, and there is also going to be a food drop-off, because the Kahnawà Food Basket has always been a participant since the holiday train has come to Kahnawake. And with the virtual concert, they'll have a drop-off at the Knights of Columbus Hall. That'll be going from 4:30 until, I better get that time right, 6:30? 7:30, yep. The concert's later at 8. So it'll be a good time, and it's a good chance for you to participate and do a good thing. And also, one last thing before we leave is that I'd like to say hats off to Dewduni Zakta. They've been selling off the Shop Kahnawake gift certificates. People have been participating in a great way, and a lot of it has to do with the fact that people are really getting into the Shop Kahnawake with COVID. They've really been participating. A lot of the local merchants are really appreciative of this, and it's good for everyone. So with that, we shall be back here on Thursday. Take care, everyone, and we'll see you next time. Yaokoa, Dano, Onigiwahi.